morning, sir. I am Casa Soriano, third year Bachelor of Science in Nursing. So now, I am ready to demonstrate the 12 cranial nerves. Hi, ma'am. I am Nurse Casa. I would like to examine the nerve around your face and your head. Would that be okay with you, ma'am?
Yes.
At this point, I am making observation of the patient to see if I can see any abnormalities in the cranial nerve distribution. This might be something like ptosis, strabismus, lack of facial expression, salivation, muscle wasting, and facial asymmetry. The first cranial nerve is the olfactory, which is responsible for the sense of smell. So, mom, have you noticed any problem with your sense of smell?
No.
No. If the patient complains anosmia or taste abnormality, this can be explored using a smell testing kit. The second cranial nerve is the optic nerve. The tested components are visual acuity, visual fields, and fundoscopy using the ophthalmoscope. I would test the visual acuity first. If the patient wears spectacles, then testing is done with the patient wearing them in order to correct any refractive errors. So, ma'am, I'd like to test your visual acuity. Can you tell me whether you wear spectacles?
No.
So, no. I would like you to read something here. Take it in your hand and cover up your right eye. Could you read the top line?
The nervous system.
Okay. Can you swap hands with your eyes? Okay.
The nervous system.
Okay, that's great. Thank you. A doctor can use a specialist chart which is likely to be available in a special clinic. If you're doing the testing at the bedside in something like a magazine or a book with suffice, if you define an if you find an abnormality in visual acuity, then you may choose a Snellen chart. It is in order to quantify the defect. So, mom, I would like to test your visual fields now. Could you cover your right eye with your right hand, like this? Okay. I would like you to look and concentrate the center of my eye. I'm going to bring my finger in, and when the finger moves, I would like you to say yes.
Yes. Yes. Yes.
While I'm doing this,
Yes.
I'm comparing the patient's visual fields with my own. Okay, could you swap your hands now, please? This. Okay. If an
Yes.
abnormality
Yes.
is detected,
Yes.
a formal
Yes.
visual assessment
Yes.
by perimetry or central field assessment would be organized. Well, in fundoscopy, it is best to dim the light in order to allow the pupil to dilate and ask the patient not to look right at the dim so that the eye stays in a fixed position. So, mom, I would like to examine the back of your eye using the ophthalmoscope. But I don't have an ophthalmoscope, so I'm using DIY ophthalmoscope. Look behind me at the clock and focus on the clock and not look straight at the light. Please notice for doing this, I am using the ophthalmoscope for examining the patient's right eye in my right hand. And I'm going to look into her right eye through my right eye. First of all, I'm going to examine the red reflex. Now, I'm going to move closer to examine the back of the eye. In looking at the optic nerves, I'm looking at the vessels, and now I'm going to scan the rest of the retina. I'm not looking to move at the left eye, but I'm going to swap the ophthalmoscope into my left hand, and I'm going to examine the patient with my left eye, looking at her left eye. Again, if you could look into distance, please check again the red reflex and then examine the back of the eye. The next cranial nerve are the cranial nerve 3, 4, and 6 that is usually examined together. Tested components of the ocular movements under pupillary reactions. First, I look at the ocular movements. I check if the normal resting position of the eyes, and then at the full range of movement. Okay, mom, I'm going to test the movement of your eyes now. What I'd like to do is to let you focus on the tip of my pen, and I would like you to follow with your eyes and keep your head stiff. So I'd also like you to tell me when you see it double at any position. So mom, you just follow my pen with your eyes only. And taking the patient's eye movement to the extreme of horizontal gaze first. And then examining the vertical gaze. At all stages, I'm looking to see if there is any stigmus in any particular position. Now going to this test for the movement of I'm now going to test for the oblique masses. Okay, ma'am. Okay, ma'am. So you didn't see any double of those positions?
No?
No. So okay. Looking at the individual nerve, the abducens innervates the lateral rectus muscles, which are responsible for the abduction of the eye. When the patient has a left 6 palsy, the lateral rectus muscle will malfunction. When the patient looks horizontally to the left side, the left eye will not abduct normally. So the patient will complain any double vision, and the images will be horizontally dispersed. So the cochlear nerve innervates the superior of the oblique muscle, and its action is demonstrated by asking the patient to look downwards and inwards. With a left 4 nerve palsy, there will be a weakness of the left and superior oblique. When the patient looks downward and inwards, they will complain of any double vision with oblique displacement of images, because the double vision occurs when looking towards the right. The patient tends to feel that there's a problem with the right eye rather than the left. All of the other eye movements involve the ocular motor nerve. This nerve also innervates V vator palpebrae superioris, where weakness will result in ptosis. In the full picture of third node palsy, the pupil will be dilated and the eye will be free downwards and outwards. Can you follow the pen again, please? As the eyes converge, both pupils are seems to constrict. The light reflex involves the perception of the light by the apparent fibers of the optic nerve with the efferent parasympathetic fibers carried by the third nerve. Now, I'm going to shine a light in your eyes. I would like to look out in the distance. In doing this, I'm going to test the direct and contextual light reflex. In the light reflex, I shine the light in the right eye and the right pupil constrict. I shine the light in the left eye and the left pupil constrict. When testing the contextual light reflex, I shine the light in the right eye and the left pupil constricts. I shine the light in the left eye and the left pupil constricts. The fifth nerve is the trigeminal that has both sensory and motor components. Light touch sensation is tested the ophthalmic maxillary and mandibular deviations. And now I'm going to touch the sensation of your face, ma'am. You can tell me, you can say yes if it feels the same side.
Yes.
The corneal reflex involves afferent fibers from the ophthalmic deviation of the trigeminal nerve and afferent for the facial nerve. So if incorrectly I touch the insensitive sclera, no response occurs. When correctly I touch the cornea, a bilateral blink responses obtained. This test is uncomfortable and it can be omitted if sensory impairments is not suspected. The motor function of the trigeminal nerve is to innervate the muscle of mastication. So, ma'am, I'm going to test your jaw muscles. Can you clench your teeth tight? Keep clenching. So I can feel the temporalis muscle contracting. And again, please. So I can feel the masseter contracting. Can you open your jaw now? The pterygoid muscle, open the jaw in the midline. Could you keep it open for me, please? The pterygoid is strong and I should not be able to overcome this movement. Can you move your jaw from side to side, ma'am? If the right pterygoid muscle is weak, the jaw will deviate to the right. And if the left muscle is weak, it will deviate to the left. So the next cranial nerve is the cranial nerve of the facial. The facial nerve innervates the muscle of the facial expression and buccellator. So, ma'am, I would like to test your facial muscle now. Could you raise your eyebrow fully? Okay. We're looking for the wrinkling of the forehead, and it's due to the contraction of the frontalis muscle, and this should be symmetrical. So now, ma'am, screw your eyes tightly together. We're testing the orbicularis oculi muscle, and I shouldn't be able to open. Hmm. Thank you. Can you smile now like this, ma'am? Okay. So I'm looking for the symmetry of the smile and equal action of the orbicularis um, or the of orbicularis muscle. And now, can you blow out your cheeks like this, ma'am? This is a function of the buccinator in the muscle. I press gently and see if there is any continence of air in the mouth. Okay, thank you, ma'am. The eighth nerve is the vestibulocochlear, which is the auditory and the balance function. So, mom, I'm going to test your hearing now. I'm going to cover one of your ear and I'm going to whisper the number. Yeah. Could you please tell me what the number is?
599.
Okay. If I detect any hearing deficit, I would move on to the tuning fork test. So, mom, going to do some tuning fork test. This is the vibrate test. Can you hear that vibrating?
Yes.
Yes. Okay. Okay. That is sound one's loud in the other?
No.
Okay, that's normal. So, we're now going to do the running test. Running test. Can you hear that vibrating?
Yes.
Okay, mom. Could you please tell me when it stops?
No.
Can you hear that?
Yes.
Okay. So that's a normal running test. I've now going to repeat the test on the opposite side. Both of these tests rely on the fact that normally air conduction is better than bone conduction. If air passages are blocked, then air conduction will be reduced and this conduction decrease. If the auditory nerve is affected, then both modalities will be reduced and this is sensory neural deficit. The next cranial nerve is the vulvar nerve that are conveniently examined together. So now, I'm going to test your throat and your mouth. First of all, can you give a loud cough, please? This tests the vagus nerve. And now I'm going to test for articulation, which involves coordination of tongue, teeth, and lips. So it requires facial vagus in the hypoglossal nerves. Could you say the days of the
Monday,
weeks?
Tuesday, Wednesday, Thursday, Friday.
What I'd like to do now is to examine the back of your throat. Could you open your mouth wide for me? Okay. Can you say
Ah.
and again, please?
Ah.
Okay. Thank you, ma'am. So, the soft palate should move upward. Should move upward to protect the nasal pharynx when the patient swallows. If there is palsy, the soft palate is pulled to the stronger side. Um, the gag reflex is elicited by gently touching the posterior pharyngeal wall on each side and results in a gag reflex. It is uncomfortable and not usually tested in the conscious patient. It requires both cranial nerves 9 and 10 for apparent and efferent rules respectively. The cranial nerve 11 is the accessory. So the accessory nerve innervates the sternomastoid muscle and the upper fiber of the trapezius. So I'm going to test your neck and shoulder, ma'am. And can you please shrug your shoulder like this? Okay. So I'm looking for the symmetrical elevation of the shoulder by the trapezius muscle here. So next, will you turn your head against my hand? I'm looking for the sternomastoid muscle here. Can you do it in the other side, ma'am? Okay, so this. So I'm looking for the sternomastoid muscle.
Next na.
So the cranial nerve 12 is the hypoglossal. It innervates the motor supply to the tongue. So, ma'am, I'm going to examine your tongue. Would you please open your mouth for me? Okay. Can you protrude your tongue? Okay. Okay. Can you move it side to side? Okay. So now, can you push your tongue against my fingers? Okay. Do it on the other side. Okay. So that ends our cranial 12 examination. Ma'am Laling, thank you very much. Ay, nairas din. Thank you, ma'am.
Thank you.
Thank you.
Thanks,